I'm Corey Powell, I'm Chairman of the Lubbock Chamber of Commerce, and we have great news to share for small businesses of West Texas. Before we get to our big announcement, I'd like to recognize a few special guests who have joined us here. From Governor Greg Abbott's office, Chandra Egemeyer, the U.S. Chamber of Commerce, Monique Theory, Senator Ted Cruz's office, we have Mary Whistler. We have U.S. Representative Jody Arrington, who you'll hear from shortly. State Senator Charles Perry. Lubbock Mayor Dan Pope. We are really excited to have all of you here and excited to share this exciting news. I'll start the announcement with some important background information first. Chambers of Commerce were founded on the idea that the power of small businesses is mighty when they unite and join forces through organizations like the Chamber. In 2006, the Lubbock Chamber of Commerce collaborated with First Care Health Plans and Lubbock's two largest health care providers, Covenant and UMC, to form an award-winning cooperative-based health plan for members that became nationally recognized. This took a great deal of vision, risk, and innovation by all of our collaborative partners at the time, and it put Lubbock on the map as a result. For that, we will forever be grateful for those partners. With an overwhelming response when we first launched the healthcare plan, our healthcare plan was well received, peaking at roughly 1,000 businesses participating in the plan, covering over 10,000 lives. We met a huge demand for healthcare coverage at a reasonable cost for businesses and their employees. However, with the passage of the ACA in 2010, the flexibility previously afforded to Chamber Health Plan was eliminated. Our hands were, and those of our collaborative partners, were virtually tied with red tape. The ability to design plans based on local market needs and preferences was eroded, and the subsequent affordability of the plans for small businesses suffered as a result. But all of that changed in October of 2017 with an executive order issued last fall by the White House that called for the creation of association health plans for smaller employers with 50 or fewer employees. Those regulations were finalized in late June of this year, and since last fall, the Lubbock Chamber actively urged and provided input into a new rule, and we worked diligently to explore solutions we could bring to small businesses without delay. The Lubbock Chamber of Commerce is here today to announce a new healthcare insurance plan option for small businesses and business members, made possible by Association Health Plans rules issued by the U.S. Department of Labor last month. Under the new rule, small businesses can enjoy the flexibility that large businesses have under the Affordable Care Act by pooling together. Until now, small businesses have been under stringent Affordable Care Act regulations, more stringent than those of large businesses. The Chamber hopes to roll out plans soon with an effective date as soon as October 1st, and is working with United Healthcare to finalize plan offerings and options. The Chamber has carefully and thoughtfully evaluated our options going forward on behalf of our members, to whom we know we are accountable for finding the best solutions for the issues that keep them up at night. United Healthcare has previously worked with industry-specific associations in similar plans, and we look forward to continuing to work with them on this process. United Healthcare has a history of working with the groups of job creators to offer innovative health solutions nationwide, but due to ACA regulations, those plans were not available to small businesses until now. Through United Healthcare, their general agency, Mutual Med, and local network of chamber member independent brokers and agents, we plan to soon roll out multiple options for various needs and situations that small businesses face. As As I mentioned earlier, the Chamber provided detailed input to the U.S. Department of Labor on association health plans, regulations earlier this year, and in May, we traveled to Washington, D.C. to discuss the importance of this issue with Senators John Cornyn and Ted Cruz, as well as Congressman Arrington and other organizations such as the U.S. Chamber of Commerce. Joining us for the announcement today is our very own Congressman Jody Arrington. The Chamber has regularly expressed healthcare-related concerns and needs of small businesses in West Texas, and we welcome him for his remarks today.
I'm proud to stand with Corey, longtime friend, former colleague at Texas Tech, and the Chamber, and I'm grateful to the leadership of the Chamber, Eddie McBride, Norma, and their team. They are an award-winning, nationally recognized chamber. I said it in my remarks earlier, and it's worth repeating again because the good people of West Texas expect the very best, and they're getting the best from this chamber. The only chamber to be recognized as a 5-star chamber 2 times, and the only chamber to be recognized as one of the best in the country 2 times. So these guys are winners, and they're trying to win for job creators so that our job creators can win for their employees and this community. There is no community. There's no cause that you can invest in if you don't have families who can make a living, and you can't make a living without the jobs and job creators. That is a hallmark of this country. And that's the reason we are the envy of the world. And so we celebrated the free enterprise system, and we understand government has a role. We understand that role is important. But too much government in a free enterprise system will make the body respond in a negative way. And I think what you've seen over the last, I would say, decade, but certainly under the last administration and their sort of policies and philosophy on how to solve these problems like access to affordable care, is more government as the solution. I don't think this has to be a political issue. I think it should be an analysis, objective analysis of the facts. The Affordable Care Act has been anything but affordable for working Americans and for small businesses. In fact, I think it's disproportionately, over-regulation of the economy. I think too much taxing actually disproportionately affects West Texas. And all these wonderful, beautiful counties that I represent that are part of this initiative. And so, again, I don't question the intent of the Affordable Care Act. I think people really, on all sides of the aisle, want to solve this problem. But I believe fundamentally that while government has a limited role, especially for the neediest among us and the most disadvantaged and our seniors, I think market-based solutions are the answer. And I think when you deregulate and when you decentralize, instead of trying to control things from Washington, top-down, government-controlled healthcare, and trying to plan a whole economy from Washington is a recipe for what we've seen, disaster. Skyrocketing premiums and deductibles, and I don't care if you have an insurance card, you don't have access to care because it's not affordable. You can't afford it. You're basically self-insured. That's why millions of people, millions, decided to pay the penalty rather than to be coerced to be on the exchange, the Obamacare exchange. Again, this is just the analysis objectively of the results of the, quote, Affordable Care Act. It's ironic it's called Affordable Care because it has produced the opposite results. This association health plan, and thanks to President Donald Trump, who is doing his part outside of Congress and passing laws of reform and repeal, he's finding ways to loosen the restrictions, lessen the burden. And what is the result of that today? A choice, a new choice. and the opportunity to band together with small businesses in this region and leverage the economy of scale to negotiate with insurance company. So now you're going to have, according to CBO, Congressional Budget Office, 15 million people who work for small businesses don't have coverage. And as a result of the new release of restrictions and deregulation around association health plans, which is only one component, I think, of decentralizing and deregulating healthcare in this country, but it's an important one. And 4 million, according to CBO, people who work for small businesses will actually have access to health insurance. And look, with an economy growing at 4% GDP, twice what it has over the last 10 years, with almost 2 million new jobs, with the highest job participation in 30 years, with 7 million surplus jobs in this country, healthcare is still the drag. It's still the ball and chain on the economy that could be on fire like you wouldn't believe. I mean, we'd see an economic renaissance like you wouldn't believe if we can solve this problem. You know who's going to solve it? Not government. We need to give more flexibility to the states. We need to give more empowerment to the consumer for choice. And we need to make sure that we deregulate an industry that can provide choices and products that we need and can afford. When that happens, even in incremental fashion, we're going to see more affordable care, we're going to see greater access. And guess what? When you actually get treated like a consumer, and providers and of insurance and healthcare actually compete for your business as a patient, you're going to have not only better or lower costs, you're going to have better quality of care. So I'm grateful to our president for taking the initiative in this way. I'm not surprised that the Lubbock Chamber has taken the leadership to provide the economic engine, the small businesses and job creators of this region with more access to care. So thanks, Corey. Thanks, Lubbock Chamber. And I say, as I always say, God bless America and keep going, West Texas.
Thank you, Congressman. We certainly appreciate your continued support of small businesses in West Texas and appreciate your presence here today. That concludes our announcement.